Discover the true meaning of skin tags. What causes skin tags? Have you ever wondered why some people have small bumps on their skin, especially in areas like the neck and armpits? Are these marks just an aesthetic nuisance, or could they indicate something more about our health? And if you have several of these marks, could this be a warning sign of deeper metabolic problems? Today, we will explore these questions and discover what skin tags are, their causes, and what they might reveal about your health. What are skin tags? Skin tags, or acrocordons, are small benign bumps that form on the skin's surface. They are made up of collagen and blood vessels covered by a layer of skin. Although they are harmless and painless, they can be an aesthetic inconvenience for many people. These marks often appear in areas where there is friction, such as around the eyes, neck, armpits, and groin. It is believed that about 25% of people will develop at least one skin tag at some point in their lives. While the exact cause of skin tags is not fully understood, several factors seem to contribute to their development. These include genetic predisposition, obesity, type 2 diabetes, and skin conditions such as squamous papilloma. Genetics play a significant role in the formation of skin tags. If your parents or grandparents have skin tags, you may be more prone to developing them as well. Additionally, skin tags are more common in older adults, overweight individuals, and those with type 2 diabetes. This suggests that hormonal and metabolic factors are involved in their formation. The association with obesity is particularly interesting. It is believed that skin friction in areas where folds and wrinkles occur can contribute to the development of skin tags. However, this explanation is not sufficient, as many thin people also develop these marks. This leads to the theory that metabolic factors, such as insulin resistance and elevated insulin levels, may play a more significant role. While skin tags are generally harmless, they can be a warning sign of underlying metabolic problems. Studies show that people with multiple skin tags are more likely to have insulin resistance, hyperinsulinemia, and metabolic syndrome. These conditions are all related to an increased risk of type 2 diabetes and cardiovascular disease. From a medical standpoint, skin tags can be removed by various methods, including surgical excision, cryotherapy, freezing, and electrocautery, burning. However, removing skin tags does not address the underlying cause. Without addressing the underlying metabolic issue, new skin tags are likely to form in the future. Therefore, if you have multiple skin tags, it is advisable to seek medical guidance. It may be a sign that you need to evaluate your metabolic health and consider lifestyle changes, such as low-carb or ketogenic diets, to improve your overall condition. In short, while skin tags are benign, they can be a valuable indicator of deeper metabolic imbalances that deserve attention. Genetic and viral components. Skin tags, or acrocordons, are often associated with genetic and possibly viral factors. Studies suggest that genetic predisposition plays a significant role in the development of these small benign bumps. If your parents or grandparents have skin tags, it is more likely that you will develop these marks over time. Genetics is one of the main factors that determine a person's propensity to develop skin tags. People with a family history of acrocordons are more likely to have them. This indicates that there is a genetic inheritance that predisposes some people to develop these marks more than others. However, genetics do not fully explain the development of skin tags, as there are other factors at play. In addition to genetics, there is a hypothesis that viral factors may be involved in the formation of skin tags. Some studies suggest a possible link between human papillomavirus, HPV, and the development of acrocordons. HPV is a virus known to cause warts on different parts of the body, and the theory is that it may influence the growth of skin tags in a similar way. However, this link is not yet fully understood, and more research is needed to confirm this association. Despite the genetic and viral theories, the main cause of skin tags seems to be related to metabolic factors. Insulin resistance and hyperinsulinemia are conditions often associated with the development of acrocordons. When the body develops insulin resistance, it needs to produce more insulin to keep blood glucose levels under control. This excess insulin can stimulate the growth of skin cells, leading to the formation of skin tags. Studies show that people with multiple skin tags are more likely to have metabolic conditions such as metabolic syndrome, prediabetes, and type 2 diabetes. This suggests that while genetics and viral factors may play a role, metabolic imbalance is a key factor in the development of skin tags. Moreover, people with obesity, hypertension, and elevated cholesterol levels are also more likely to develop skin tags. These factors are all interrelated with metabolic syndrome, which is a set of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. Therefore, skin tags can be a visible indicator of underlying metabolic problems that need to be addressed. In conclusion, while genetics and viral factors may influence the development of skin tags, the main cause seems to be related to metabolic factors. Insulin resistance, hyperinsulinemia, and other metabolic conditions play a crucial role in the growth of these marks. Therefore, if you have multiple skin tags, it is important to consider a medical evaluation to investigate possible metabolic problems and take steps to improve your overall health. Metabolic syndrome and skin tags. Metabolic syndrome is a cluster of conditions that increase the risk of heart disease, strokes, and type 2 diabetes. These conditions include elevated blood pressure, high blood sugar levels, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. The presence of any of these conditions increases the risk of serious health problems. But when they occur together, the risk is even higher. There is a significant correlation between metabolic syndrome and the development of skin tags. Studies show that people with multiple skin tags are more likely to have conditions that are part of metabolic syndrome, such as insulin resistance, hyperinsulinemia, and obesity. This suggests that skin tags may be a visible sign that something is wrong with the body's metabolism. Insulin resistance is a central feature of metabolic syndrome. It occurs when the body's cells do not respond well to insulin, a hormone produced by the pancreas that helps regulate blood sugar levels. When the cells become insulin resistant, the body needs to produce more insulin to help transport glucose into the cells. This increase in insulin levels, or hyperinsulinemia, can lead to the development of skin tags. Hyperinsulinemia is often a precursor to prediabetes and type 2 diabetes. Prediabetes is a condition in which blood sugar levels are higher than normal but not high enough to be classified as diabetes. If left untreated, prediabetes can progress to type 2 diabetes, a chronic disease that affects how the body metabolizes glucose. Therefore, skin tags can be an early sign of blood sugar and insulin problems. Obesity is also closely linked to metabolic syndrome and the development of skin tags. Obese people are more likely to develop insulin resistance and hyperinsulinemia, which, in turn, increases the risk of developing acrocortins. Additionally, excess body fat, especially around the waist, is associated with a higher risk of metabolic syndrome and its complications. Furthermore, abnormal cholesterol and triglyceride levels are common in people with metabolic syndrome. These lipid imbalances can contribute to the development of cardiovascular diseases and other health problems. The presence of multiple skin tags may be an indicator that it is necessary to evaluate cholesterol and triglyceride levels and take steps to improve metabolic health. In conclusion, metabolic syndrome is a serious condition that can significantly increase the risk of chronic diseases and health complications. Skin tags can be a visible sign of underlying metabolic problems and should be considered a warning for the need for medical evaluation. Treating the underlying cause of metabolic syndrome, often through dietary and lifestyle changes, can not only improve overall health but also reduce the number of skin tags. Insulin resistance and hyperinsulinemia. Insulin resistance is a condition in which the body's cells become less sensitive to insulin, a crucial hormone for regulating blood glucose levels. When cells do not respond adequately to insulin, the pancreas is forced to produce more insulin to compensate. This increase in insulin production is known as hyperinsulinemia. Insulin resistance is often a precursor to various metabolic conditions, including metabolic syndrome, prediabetes, and type 2 diabetes. When the body produces more insulin to overcome cellular resistance, elevated insulin levels can cause a series of adverse effects. One of these effects is the development of skin tags. Hyperinsulinemia, or elevated insulin levels in the blood, has been associated with the growth of skin cells, leading to the formation of skin tags. Studies show that people with multiple skin tags are more likely to have insulin resistance and hyperinsulinemia. This suggests that skin tags may be a visible sign of underlying problems with insulin and metabolism. In addition to contributing to the development of skin tags, Insulin resistance and hyperinsulinemia can have several other negative health effects. For example, elevated insulin levels are associated with an increased risk of obesity, high blood pressure, abnormal cholesterol and triglyceride levels, and a higher risk of cardiovascular diseases. These conditions are all interrelated and are part of the metabolic syndrome picture. Insulin resistance often occurs in conjunction with excess weight and obesity. Adipose tissue, especially visceral adipose tissue around the abdominal organs, is metabolically active and can release substances that promote insulin resistance. This creates a vicious cycle in which insulin resistance leads to the accumulation of more fat, and fat accumulation exacerbates insulin resistance. Treating insulin resistance is crucial for improving metabolic health and reducing the risk of developing chronic conditions such as type 2 diabetes and heart disease. One of the most effective ways to address insulin resistance is through dietary and lifestyle changes. Low-carb, ketogenic, and carnivorous diets have been shown to be effective for many people, helping to lower blood sugar and insulin levels and improving insulin sensitivity. In addition to dietary changes, increasing physical activity, losing weight, and managing stress can also help improve insulin resistance. Regular exercise, such as walking, running, cycling, and strength training, can increase cells' sensitivity to insulin and help control blood sugar levels. In summary, insulin resistance and hyperinsulinemia are conditions that can significantly impact overall health and the risk of developing chronic diseases. Skin tags can be a visible sign of problems with insulin and metabolism, indicating the need for evaluation and medical intervention. Addressing insulin resistance through dietary changes, increased physical activity, and other interventions can improve metabolic health and reduce the risk of complications. Prediabetes and type 2 diabetes. Prediabetes and type 2 diabetes are interrelated metabolic conditions that affect how the body metabolizes glucose. Prediabetes is a condition in which blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. However, without intervention, prediabetes often progresses to type 2 diabetes, a chronic disease that can lead to various health complications. Insulin resistance is a key factor in the development of prediabetes and type 2 diabetes. When the body's cells do not respond adequately to insulin, the pancreas is forced to produce more insulin to keep blood glucose levels within the normal range. This increase in insulin production, known as hyperinsulinemia, can eventually lead to the depletion of pancreatic beta cells, resulting in elevated blood glucose levels. People with prediabetes often do not show symptoms, making the condition difficult to detect without blood tests. However, a visible sign of underlying metabolic problems can be the development of skin tags. Studies show a significant correlation between the number of skin tags a person has and the risk of developing prediabetes and type 2 diabetes. Therefore, skin tags can be an early indicator of metabolic imbalances. If left untreated, prediabetes can progress to type 2 diabetes. Type 2 diabetes is characterized by elevated blood glucose levels resulting from insulin resistance and the failure of pancreatic beta cells to produce enough insulin. This chronic condition can lead to various health complications, including cardiovascular disease, neuropathy, retinopathy, and kidney disease. Managing prediabetes and type 2 diabetes involves lifestyle changes, medication, and, in some cases, surgical intervention. One of the most effective interventions is adopting a healthy diet. Low-carb, ketogenic, carnivorous, Banting, and Atkins diets have been shown to be effective for many people in controlling blood glucose levels and improving insulin sensitivity. In addition to dietary changes, increasing physical activity is crucial. Regular exercise helps to increase cells' sensitivity to insulin, facilitating the control of blood glucose levels. Weight loss is also important, as excess body fat, especially visceral fat, is associated with insulin resistance and the development of type 2 diabetes. Medications such as metformin can be prescribed to help control blood glucose levels in people with prediabetes and type 2 diabetes. In some cases, bariatric surgery may be considered for obese individuals who cannot control their blood glucose levels through diet and exercise alone. In summary, prediabetes and type 2 diabetes are serious metabolic conditions that can lead to various health complications. Skin tags can be a visible sign of underlying problems with insulin and glucose, indicating the need for medical evaluation and intervention. Addressing these conditions through dietary changes, increased physical activity, weight loss, and, if necessary, medication can significantly improve metabolic health and reduce the risk of complications. Obesity and skin tags. Obesity is a health condition characterized by excess body fat, which can increase the risk of various chronic diseases, including type 2 diabetes, heart disease, and hypertension. There is a significant relationship between obesity and the development of skin tags, or acrocortins. Obese individuals are more likely to develop these small benign bumps, which can be a visible indicator of underlying metabolic problems. Obesity is often associated with insulin resistance, a condition in which the body's cells do not respond adequately to insulin. This leads the pancreas to produce more insulin to help maintain blood glucose levels. This increase in insulin production, known as hyperinsulinemia, can stimulate the growth of skin cells, resulting in the development of skin tags. In addition to insulin resistance, obesity is associated with elevated levels of inflammation in the body. Adipose tissue, especially visceral adipose tissue that accumulates around abdominal organs, is metabolically active and can release inflammatory substances that contribute to the development of metabolic conditions such as metabolic syndrome. These substances can also influence the growth of skin cells, leading to the formation of acrocortins. Obese individuals are also more likely to develop other conditions that are part of metabolic syndrome, including hypertension, elevated cholesterol and triglyceride levels, and elevated blood sugar levels. These conditions are all interrelated and can increase the risk of cardiovascular disease and type 2 diabetes. Skin tags can be a visible sign that these metabolic conditions are present. Excess weight, especially visceral fat, is associated with a higher risk of metabolic syndrome and its complications. This creates a vicious cycle in which insulin resistance leads to the accumulation of more fat, and fat accumulation exacerbates insulin resistance. Therefore, weight loss is a crucial strategy for improving metabolic health and reducing the risk of developing skin tags. Weight loss can be achieved through dietary and lifestyle changes. Low-carb, ketogenic, carnivorous, Banting, and Atkins diets have been shown to be effective for many people in reducing body weight and improving insulin sensitivity. These diets help normalize blood sugar and insulin levels, addressing the underlying cause of the development of acrocortins. In addition to dietary changes, increasing physical activity is essential for weight loss and improving metabolic health. Regular exercise, such as walking, running, cycling, and strength training, can help increase cell sensitivity to insulin and promote fat loss. Managing stress and getting adequate sleep are also important for metabolic health and weight loss. In summary, obesity is a serious health condition associated with a higher risk of developing skin tags and other metabolic conditions. Addressing obesity through dietary changes, increased physical activity, weight loss, and other interventions can significantly improve metabolic health and reduce the risk of complications. Skin tags can be a visible sign that it is necessary to evaluate and treat underlying problems with insulin and metabolism. Low-carb, ketogenic, carnivorous, Banting, and Atkins diets. Low-carb, ketogenic, carnivorous, Banting, and Atkins diets have been shown to be effective for many people in reducing weight, improving metabolic health, and, surprisingly, decreasing or eliminating skin tags. These diets share the common feature of reducing carbohydrate intake, which can have a significant impact on blood sugar and insulin levels. The low-carb diet, as the name suggests, involves reducing carbohydrate intake. This can range from moderate reduction to severe carbohydrate restriction. By limiting the amount of carbohydrates consumed, the body is forced to use fat as its primary energy source. This can lead to weight loss and improved insulin sensitivity, which in turn can reduce hyperinsulinemia and the risk of developing skin tags. The ketogenic, or keto, diet is a more restrictive form of a low-carb diet that involves consuming very low amounts of carbohydrates, moderate amounts of protein, and high amounts of fat. The goal of the ketogenic diet is to induce a metabolic state called ketosis, in which the body burns fat for energy instead of carbohydrates. Ketosis has been associated with a range of health benefits, including improved insulin sensitivity, reduced blood sugar levels, and weight loss. Many people report that their skin tags decrease or disappear completely after following a ketogenic diet. The carnivorous diet is an even more extreme approach that involves eating only animal products, such as meat, fish, eggs, and dairy. The theory behind the carnivorous diet is that carbohydrates are unnecessary and potentially harmful to health. Although the carnivorous diet is controversial and has not been widely studied, some people report significant improvements in metabolic health and skin appearance after adopting it. The Banting diet is a form of low-carb diet that gained popularity in the 19th century and has been revitalized in recent years. It involves reducing carbohydrate intake and increasing the intake of healthy fats. The Banting diet can help normalize blood sugar and insulin levels, improving metabolic health and reducing the risk of developing skin tags. The Atkins diet is one of the most well-known low-carb diets and was developed by Dr. Robert Atkins. It involves several phases, starting with a severe restriction of carbohydrates and gradually reintroducing them as weight is lost and metabolic health improves. The Atkins diet has been associated with weight loss, improved insulin sensitivity, and reduced blood sugar levels. These diets share the ability to reduce blood sugar and insulin levels, addressing the underlying cause of insulin resistance and hyperinsulinemia. This can lead to a range of health benefits, including the reduction of skin tags. Many success stories indicate that people who adopted these diets not only lost weight and improved their metabolic health, but also noticed that their skin tags decreased or disappeared completely. In conclusion, low-carb, ketogenic, carnivorous, Banting, and Atkins diets can be effective strategies for improving metabolic health and reducing the number of skin tags. By normalizing blood sugar and insulin levels, these diets address the underlying cause of the development of acrocortins. If you have skin tags and are concerned about your metabolic health, considering one of these diets may be an important step to improving your overall condition. Removal methods and underlying causes. Skin tags or acrocortins are often seen as a minor aesthetic problem that can be removed through simple procedures. However, it is crucial to understand that removing skin tags without addressing the underlying cause is only a temporary solution. If the underlying cause, such as insulin resistance or hyperinsulinemia, is not treated, new skin tags are likely to continue appearing. The main concern with skin tags is what they can indicate about your metabolic health. As mentioned earlier, there is a significant correlation between the number of skin tags and the risk of developing conditions such as metabolic syndrome, prediabetes, and type 2 diabetes. This means that skin tags can be a visible sign that something is wrong internally and needs to be addressed. Treating only the skin tags with surgical procedures, cryotherapy, or electrocautery can temporarily remove the aesthetic problem but does not resolve the root cause. Insulin resistance and hyperinsulinemia, which are often behind the development of skin tags, continue to cause metabolic damage if not treated. This can lead to more serious complications in the future, such as cardiovascular diseases, neuropathy, retinopathy, and kidney disease. Addressing the underlying cause of skin tags involves lifestyle changes that improve metabolic health. Low-carb, ketogenic, carnivorous, Banting, and Atkins diets are effective because they help normalize blood sugar and insulin levels, directly addressing insulin resistance and hyperinsulinemia. These diets can not only prevent the appearance of new skin tags but also reduce or eliminate existing ones. In addition to dietary changes, increasing physical activity is crucial for improving insulin sensitivity and metabolic health. Regular exercise helps reduce blood sugar and insulin levels, promoting weight loss and improving overall metabolism. Managing stress and getting adequate sleep are also important, as stress and lack of sleep can negatively affect insulin sensitivity and cortisol levels, exacerbating metabolic problems. In summary, it is important to treat the underlying cause of skin tags to improve metabolic health and prevent future complications. Removing skin tags without addressing insulin resistance and hyperinsulinemia is only a temporary solution that does not resolve the underlying problem. Adopting a healthy diet, increasing physical activity, managing stress, and ensuring adequate sleep are essential steps to treat the root cause and improve overall health. By doing so, you can not only reduce the number of skin tags but also significantly improve your metabolic health and reduce the risk of developing chronic conditions. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.